A patient asks if they can cut an extended-release tablet in half. What should the pharmacy technician do? A. Advise the patient it is safe to cut. B. Tell the patient to ask their physician or pharmacist. C. Cut the tablet for the patient. D. Replace with a liquid form without checking. Answer: B. Extended-release tablets should not be split or crushed. The technician must refer the patient to the pharmacist for professional guidance to ensure safety. Which DA schedule classification applies to alprazolam? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer: D. Alprazolam is a benzodiazepine classified as Schedule 4 due to its lower potential for abuse compared to Schedule 2 and 3 substances. What is the maximum number of refills allowed for a Schedule 3 prescription under federal law? A. 2. B. 3. C. 5. D. Unlimited. Answer: C. Federal law allows up to 5 refills for Schedule 3 and 4 prescriptions within 6 months of the issue date. A patient brings in a prescription written as amoxicillin 250 mg POTID times 10 days. How many capsules are needed to complete the course? A. 20. B. 30. C. 40. D. 60. Answer: B. 3 doses per day times 10 days equals 30 doses. At 250 mg per dose, the patient requires 30 capsules. Since the prescription is for TID times 10 days, total equals 30 capsules. Which of the following medications must be stored in the refrigerator? A. Insulin. B. Lisinopril. C. Metoprolol. D. Acetaminophen. Answer: A. Insulin should be stored in the refrigerator until opened. Proper storage maintains potency and stability. A prescription reads Sig. 1 tab Q6-HPRN pain. What is the maximum number of tablets a patient may take in 24 hours? A. 2. B. 4. C. 6. D. 8. Answer: B. 1 tablet every 6 hours allows up to 4 doses in 24 hours. A pharmacy technician notices a bottle labeled metoprolol 50 mg but containing tablets marked for 100 mg. What should the technician do? A. Relabel the bottle correctly. B. Dispense it as is. C. Quarantine and alert the pharmacist. D. Ignore and return to stock. Answer: C. Mismatched labeling and content indicate a potential dispensing error. The technician must quarantine and alert the pharmacist. What is the beyond use date, BUD, for a non-aqueous compounded oral solution without stability data? A. 7 days. B. 14 days. C. 30 days. D. 180 days. Answer: C. For non-aqueous formulations, USP less than 795 recommends a beyond use date not later than 6 months or 30 days after opening, whichever is earlier. Which of the following drugs is classified as a proton pump inhibitor, PPI? A. Omeprazole. B. Ranitidine. C. Famotidine. D. Sucralfate. Answer: A. Omeprazole is a PPI used to reduce stomach acid. Ranitidine and famotidine are H2 blockers, while sucralfate is a mucosal protectant. Which route of administration delivers medication directly into the muscle? A. 4. B. IM. C. SC. D. PA. Answer: B. Intramuscular (IM) injections deliver drugs into the muscle for slower absorption compared to intravenous administration. A patient is prescribed 250 milliliters of an antibiotic suspension at 10 milliliters bid. How many days will the bottle last? A. 10 days. B. 12.5 days. C. 25 days. D. 30 days. Answer B. 10 milliliters twice daily equals 20 milliliters per day. 250 divided by 20 is equal to 12.5 days. Which auxiliary label should be applied to metronidazole? A. Avoid sunlight. B. May cause drowsiness. C. Do not drink alcohol. D. Take with milk. Answer C. Alcohol should not be consumed with metronidazole due to risk of severe disulfiram-like reactions. Which dosage form bypasses the digestive system? A. Oral tablet. B. Intravenous injection. C. Capsule. D. Suspension. Answer B. Intravenous administration delivers drugs directly into the bloodstream, bypassing the digestive system. Which of the following is an example of a loop diuretic? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Amiloride. Answer A. Furosemide is a loop diuretic that works on the ascending loop of Henle to increase urine output. A pharmacy technician receives a prescription for warfarin 5 mg daily. What is the most critical step before dispensing? A. Confirm patient's INR monitoring. B. Check for allergies. C. Confirm generic availability. D. Verify insurance coverage. Answer A. Warfarin requires INR monitoring to prevent bleeding or clotting complications. This safety check is essential. Which of the following is a common side effect of ACE inhibitors like lisinopril? A. Constipation. B. Dry cough. C. Sedation. D. Weight gain. Answer B. ACE inhibitors often cause a persistent dry cough due to bradykinin accumulation. A patient is prescribed 30 g of an ointment to be applied twice daily for 10 days. How much ointment is needed? A. 20 g. B. 30 g. C. 60 g. D. 90 g. Answer C. Twice daily for 10 days equals 20 applications. At 3 g per application, total equals 60 g. Which type of prescription requires a DEA number? A. Antibiotic prescription. B. Controlled substance prescription. C. OTC recommendation. D. Herbal supplement. Answer B. DEA numbers are required on all controlled substance prescriptions to ensure proper tracking and legal compliance. Which of the following tasks is outside the scope of practice for a pharmacy technician? A. Counting pills. B. Compounding creams. C. Counseling a patient on side effects. D. Printing prescription labels. Answer C. Counseling is the pharmacist's responsibility. Technicians support with technical tasks but cannot provide clinical counseling. What is the generic name for Zocor? A. Atorvastatin. B. Levastatin. C. Simvastatin. D. Rosuvastatin. Answer C. Zocor is the brand name for simvastatin, a cholesterol-lowering medication. Which of the following insulin types is rapid-acting? A. Insulin glargine. B. Insulin Lispro. C. NPH insulin. D. Insulin Detamir. Answer B. Insulin Lispro is rapid-acting, typically administered before meals to control postprandial glucose. Which law requires patient counseling by pharmacists on new prescriptions? A. OBRA 90. B. HIPAA. C. Durham-Humphrey Amendment. D. Controlled Substances Act. Answer A. OBRA 90 mandates pharmacists to counsel Medicaid patients, setting the foundation for broader patient counseling practices. Which medication requires REMS, risk evaluation and mitigation strategy? A. Isotretinoin. B. Ibuprofen. C. Acetaminophen. D. Metformin. Answer A. Isotretinoin requires strict REMS monitoring due to high risk of birth defects. Which of the following is measured using an insulin syringe? A. Milligrams. B. Units. C. Liters. D. Grams. Answer B. Insulin syringes are calibrated in units, not milligrams or grams. Which federal law requires tamper-resistant packaging for most OTC drugs? A. HIPAA. B. OBRA 90. C. Poison Prevention Packaging Act. D. Kefauver-Harris Amendment. Answer C. This act requires child-resistant packaging to prevent accidental poisoning. Which of the following medications is an anticoagulant? A. Clopidogrel. B. Warfarin. C. Enoxaparin. D. All of the above. Answer D. Warfarin, oral, enoxaparin, injectable, and clopidogrel, antiplatelet, all act on the blood clotting system. Though mechanisms differ, all reduce clotting risk. Which organization sets standards for medication compounding? A. FDA. B. DEA. C. USP. D. CDC. Answer C. The U.S. Pharmacopoeia, USP, establishes standards for drug quality, purity, and compounding practices such as USP less than 795, less than 797, and less than 800. A technician prepares to reconstitute an antibiotic powder. What is the first step? A. Shake vigorously. B. Add diluent directly without checking. C. Verify the correct diluent and volume. D. Dispense without mixing. Answer C. Always confirm the type and amount of diluent before mixing. Incorrect reconstitution can alter strength and stability. Which auxiliary label should be placed on a prescription for doxycycline? A. Take with grapefruit juice. B. Do not take with dairy products. C. Avoid caffeine. D. Take with high-fat foods. Answer B. Dairy products interfere with absorption of tetracyclines like doxycycline, reducing effectiveness. Which of the following is a high-alert medication? A. Ibuprofen. B. Heparin. C. Loratadine. D. Acetaminophen. Answer B. Heparin is classified as a high-alert drug due to significant risk of harm if a dosing error occurs. A prescription is written for lisinopril 10 mg PO daily times 30 days. How many tablets should be dispensed? A. 10. B. 15. C. 30. D. 60. Answer C. Once daily for 30 days equals 30 tablets total. Straightforward calculations prevent dispensing errors. Which of the following is required on a controlled substance prescription? A. Patient's age. B. DEA number of prescriber. C. Insurance policy number. D. Pharmacist's initials. Answer B. Controlled prescriptions must include the prescriber's valid DA number for legal dispensing. Which drug is an example of a benzodiazepine? A. Diazepam. B. Fluoxetine. C. Atenolol. D. Levothyroxine. Answer A. Diazepam is a benzodiazepine used for anxiety and seizures. Fluoxetine is an SSRI, atenolol is a beta blocker, and levothyroxine treats hypothyroidism. Which type of medication error occurs when the wrong strength of a drug is dispensed? A. Wrong drug error. B. Wrong dose error. C. Wrong patient error. D. Wrong route error. Answer B. Dispensing the wrong strength constitutes a dosing error. It may result in underdosing or overdosing. Which law created the distinction between prescription and OTC medications? A. Durham-Humphrey Amendment. B. Kefauver-Harris Amendment. C. Controlled Substances Act. D. OBRA 90. Answer A. The Durham-Humphrey Amendment of 1951 established legend, Rx-only, and over-the-counter drug categories. What is the purpose of HIPAA in pharmacy practice? A. To regulate controlled substances. B. To ensure patient confidentiality. C. To prevent medication errors. D. To oversee drug recalls. Answer B. HIPAA protects patient health information, ensuring privacy and secure handling of medical records. A technician calculates a dose using Clark's rule. What factor does this formula use? A. Patient's height. B. Patient's weight. C. Patient's age. D. Patient's gender. Answer B. Clark's rule uses weight-based dosing relative to the adult dose. Pediatric dose equals weight divided by 150 times adult dose. Which class of medication is atorvastatin? A. Beta blocker. B. ACE inhibitor. C. Statin. D. Calcium channel blocker. Answer C. Atorvastatin is a statin that lowers cholesterol by inhibiting HMG-CoA reductase. Which dosage form is designed for absorption under the tongue? A. Buccal tablet. B. Sublingual tablet. C. Enteric-coated tablet. D. Suppository. Answer B. Sublingual tablets dissolve under the tongue for rapid absorption into the bloodstream. A patient presents a prescription for fentanyl patch 25 micrograms per hour. What should the technician do first? A. Hand it directly to the patient. B. Verify DA number and consult pharmacist. C. Cut patch in half for smaller dose. D. Store it with OTC medications. Answer B. Fentanyl is a Schedule II opioid. The DA number must be verified and pharmacist must review before dispensing. Which drug is classified as a selective serotonin reuptake inhibitor, SSRI? A. Sertraline. B. Diazepam. C. Metformin. D. Lorazepam. Answer A. Sertraline is an SSRI used for depression and anxiety disorders. Which of the following is an example of lookalike/soundalike drugs? A. Celebrex and Celexa. B. Tylenol and Advil. C. Insulin and glucagon. D. Amoxicillin and azithromycin. Answer A. Celebrex, arthritis, and Celexa, antidepressant, are lookalike/soundalike medications with high error risk. A prescription reads hydrochlorothiazide 25 mg PO daily times 90 days. How many tablets are needed? A. 30. B. 60. C. 90. D. 180. Answer: C. 1 daily for 90 days equals 90 tablets. Which federal law requires reporting of medication errors and adverse drug reactions? A. Kefauver-Harris Amendment. B. MedWatch Program. C. OBRA 90. D. HIPAA. Answer: B. The FDA MedWatch program collects reports on adverse events and medication errors to improve patient safety. Which auxiliary label should be applied to nitroglycerin sublingual tablets? A. Keep in original container. B. Take with milk. C. May cause constipation. D. Avoid sunlight. Answer: A. Nitroglycerin is unstable and must be stored in its original amber glass container to protect potency. Which of the following insulins is long-acting? A. Lispro. B. Aspart. C. Glargine. D. Regular insulin. Answer: C. Insulin glargine is long-acting, providing basal coverage for 24 hours. What is the generic name for Plavix? A. Warfarin. B. Clopidogrel. C. Heparin. D. Dabigatran. Answer: B. Plavix is the brand name for clopidogrel, an antiplatelet drug used to prevent clots. Which storage condition is appropriate for most tablets and capsules? A. Freezer at -20 degrees Celsius. B. Room temperature 20 to 25 degrees Celsius. C. Refrigerator at 2 to 8 degrees Celsius. D. Warm, humid storage. Answer: B. Most oral solid dosage forms are stable at controlled room temperature, 20 to 25 degrees Celsius. Which law established the DEA and created drug schedules? A. Controlled Substances Act of 1970. B. Durham-Humphrey Amendment. C. Pure Food and Drug Act. D. Hatch-Waxman Act. Answer: A. The Controlled Substances Act created the DEA and established drug scheduling for controlled substances. Which of the following is a sign of a potential forged prescription? A. Large quantities of controlled drugs. B. Altered handwriting. C. Patient insists on brand only. D. All of the above. Answer: D. Forged prescriptions often involve large quantities, inconsistent handwriting, or unusual requests. Technicians must alert the pharmacist.